Hi, and welcome to How Humans Heal. I'm Dr. Donnie Wilson, naturopathic doctor and women's health expert. And in this video and episode, I'm going to be talking about the concept of the magic pill. And I'm going to be especially using it to talk about risk for HPV-related cancer, specifically cervical cancer in women. But I encourage you to listen in from any kind of health issue that you're dealing with to understand better the mindset and perspective and paradigm shift that I see my patients making in order to truly transform their health. So let's dig into understanding the concept of the magic pill and instead what actually ends up helping people heal. Here we are on the How Humans Heal podcast. So, the magic pill concept is really a fictional medication or hypothetical medication that can miraculously heal or cure any kind of health issue from a single pill without any side effects, without any limitations, right? And I think we can all relate to this, right? We would all love it if there was some magic pill we could swallow that takes all of our pain away, our physical pain, emotional pain, cancer risk, whatever's going on with troubles in our life and our health. Wouldn't that be so amazing if we could just take a pill and it goes away? It sounds like a really good movie, actually. So just to point out that a lot of times we're in that way of thinking. Right? Believe me, when we get a headache, we go, where's that pill I could take to take the headache away, right? And sometimes it works. Sometimes we can take a pill and the headache goes away. The problem is if we get a headache every day and we take that pill every day, eventually that pill can start to have side effects and negative effects in our bodies. And now, even if that pill is taking our headache away, it might be causing a stomachache, for example, right? And so this is the limitations of those pills that we often go to. We have to learn as humans, we have to kind of stop ourselves from chasing that next shiny object, hoping that one thing is going to fix it and take it away and we're never going to have to think about it again. And to realize that the reality is, the truth is, that most often things are not really fixed with a magic pill. It's more like they're resolved with true intention and transformation. And so I invite you, if whatever health issue you might be struggling with, whether it's fatigue, anxiety, sleep issues, digestive issues, autoimmunity, fertility, perimenopausal symptoms, and maybe you have high-risk HPV and abnormal pap smear, and you're in that struggle, right? Believe me, I understand it because I've had health issues myself. I myself dealt with HPV at a younger age. I also dealt with severe chronic migraine headaches for decades. I also have dealt with joint hypermobility and arthritis. So I know what it is. I've also been exposed to narcissistic abuse and the emotional pain of narcissistic abuse. So I've experienced both emotional pain and physical pain in my life. And so I'm speaking, yes, as a naturopathic doctor and clinical nutritionist and midwife, and also as a human who's been through the pain, emotional and physical pain of suffering and the fear of what's going to happen next. Could this impact my life as I know it? And of course, this can trigger our stress response. We have a built-in stress response system. And of course, when we're dealing with the unknown and what's going to happen to us, it can trigger our stress response system. When our stress response is triggered, that's when we're going to feel more fear, worry, anxiety, sleeplessness, hopelessness, and it just spirals. So if you found yourself in this spiral of fear, what can actually happen is we become paralyzed. We become paralyzed in the fear of what other people think, what other people say, And a lot of times, if we start looking to what other people say, they might be saying to us, there's nothing you can do about it. It's never going to get better. You might be hearing these negative messages out there, especially if you've been dealing with high-risk HPV and abnormal pap smear. Women tell me all the time the messages they hear, which have to do with it will never go away. It's going to hide in your body. It's going to come back. All of these negative messages about how it's impossible to do anything about it. And people hear this about autoimmunity. There's nothing you can do. It's only going to get worse. Or they hear this about, you name it, heart disease, dementia, diabetes. You can, no matter what health issue, you can end up finding perspectives out there, even from medical doctors who are saying, there's nothing you can do. And really, I think, because I have a lot of friends who are medical doctors, and we've talked about this, and they've explained to me that it's not that there's nothing, it's that they haven't learned anything that they can do. Because you have to understand that any expert is going based on their training and their experience. And the training of a medical doctor doesn't include very much nutrition. It doesn't include any herbs. It doesn't include mind-body connection. And it certainly doesn't include looking at underlying causes to prevent health issues. Their training includes the use of procedures, surgeries, and pharmaceuticals, usually to address an acute injury, a life-threatening situation, and potentially a medication to suppress what's going on, right? So we can take a medication to suppress pain. It's not getting to the underlying cause of the pain, like a migraine. It's just suppressing the pain, and then the symptoms can recur again, right? Even with autoimmunity, the medications suppress the immune system or modulate the immune system, but it's not correcting the reason why the autoimmunity is there to begin with. And the same with the HPV. You can do a surgery to remove abnormal cells, but it doesn't take care of the virus. And so the virus can cause abnormal cells again. So I'm just pointing this out to show clearly, more clearly, I'm hoping, what's really like to be able to stand back. And my point is that I think as humans, when we can take the opportunity to stand back in our life and say, what really if I'm taking a pill for something, what really is the intention and purpose behind that pill? And does it have limitations? Does it have potential side effects? Am I going to become dependent on it? Is it simply suppressing something? Is there going to be withdrawal symptoms or anxiety? We take sometimes medications for anxiety, but it's not really solving the underlying cause of the anxiety. It's simply suppressing the symptoms. And then we become dependent on the substance. Same thing can happen with alcohol or food for that matter. We go toward a substance to suppress or help us in the moment, but then it ends up having side effects and being harmful to our health in the long run. So that just is something that I'm always very aware of for my health and for my patients' health is how can we stand back and look at this from a different perspective and say, hey, how can we do this differently, right? Instead of simply going for a quick fix, it's not really a fix. It's a quick suppression that leads to perpetuating the issue, really. So if we start to see that and we go, wait a minute, we need a different strategy here because this strategy might be useful in certain situations, but it's not really solving our long-term health issues or improving our longevity, improving our lifespan, improving our quality of life over years. So instead of just going for that quick fix, and especially something like HPV, there is no pill. There's no pill that's available that's going to kill HPV. Now, I'm talking about human papillomavirus, right? And there's low-risk human papillomavirus that causes warts, and there's high-risk human papillomavirus that's associated with cancer risk. So we want to deal with this high-risk HPV because we don't want it to cause cancer, but at this moment in time, there's no pharmaceutical that you can take to wipe out the HPV or even to suppress it for that matter. So we're kind of forced to think outside the box. We're forced to say, okay, do we just give in and let this virus go on its way, causing abnormal cells and cancer potentially? Or do we decide as a human in this body, in this experience, decide to stand back and get a different perspective on things? And that's what I'm encouraging you to do. I'm encouraging you to say, hey, there's a reason why your body's not clearing HPV. Because the human body can. We have a Th1 immune system that clears viruses, including HPV. So if you're human and you have a human immune system, your human immune system should be able to clear HPV. So if it's not just about being exposed to HPV, it's about why is your body not protecting you from HPV? And I have identified 8 most common underlying causes of why your body's not clearing HPV. There may be more than 8, but I have come to the most common 8 that I see in helping thousands of women with high-risk HPV. And so I'm going to go through that list of 8 most common susceptibilities with you. And it's really about saying this classic analogy of a bucket with holes in it, right? So we could just, like a lot of times people will hear for high-risk HPV and human papillomavirus, you might see online in different places, oh, you could take a mushroom extract like AHCC, which is a shiitake mushroom extract. And there is some research on AHCC, quite a lot of research, and it's partially effective at helping with HPV, but it's not 100% effective, right? So it's not really the magic pill because it's not like one pill, one time solves this for everyone. No. So we have to know, oh, okay, there's some potential for this, but we're not going to put all of our eggs in that one basket. So you'll come across things for high-risk HPV. You'll hear about mushrooms. You hear about Chinese herbs. You'll hear about other kinds of herbs. You might hear about vitamin C or other vitamins. You might hear about vaginal suppositories. But the idea is if you have a bucket with holes in it and you just keep putting in more water in the bucket, right? You're like, oh, okay, the water's not staying in the bucket. I'm just going to keep putting more water, right? So a lot of times people take this approach. I'm going to just put it under the faucet and pour more water in. Now, if you keep the water going, you're going to temporarily have some water in the bucket, but it's going to keep draining out the holes. You're going to lose the water over and over again. So it's like I think a lot of the times what I see people doing when it comes to human papillomavirus and other health issues is we just keep thinking we're going to fill the bucket, but we're not actually fixing the holes in the bucket. And so I'm inviting you to pay attention to the holes in the bucket. And once we can identify the holes in the bucket, what's actually depleting your system, and fix the holes in the bucket, then lo and behold, your body starts protecting you from high-risk HPV virus again, because we know based on studies that the human body can clear this virus, but we need a functioning immune system and microbiome in order to do that. Are you feeling overwhelmed and afraid of the HPV virus? Feeling like you have more questions than answers, and your doctor's office is just telling you to wait and see, and you're not okay with just to wait and see if it causes cancer? Well, I'm Dr. Donnie, and I'm a women's health and HPV expert. I've been helping women for over 20 years to understand HPV and understand what you can do to protect yourself from the virus now and into the future. There are actually research studies to show that diet and lifestyle, nutrients and herbs can effectively help us to clear the virus to negative and prevent it from coming back again. So I created a free online class. It's called the Secrets to Clear HPV Masterclass. And if you just click the link down below, you can log in and listen to that class. And in under an hour, learn the myths and misconceptions. We're going to break those myths, and I'm going to teach you the facts you need to know in order to achieve a negative pap smear result. I look forward to seeing you over at the masterclass. So it's about looking at the bigger picture, taking a different perspective, and I would even say a paradigm shift. Sometimes we literally have to realize that if we continue listening to this other way of thinking, you're never going to get rid of it and you're just going into the standard medical system, they're not going to teach you how to prevent. And they're not going to talk to you about this bigger perspective of addressing the holes in the bucket using natural approaches. So if you want a different outcome, you want to reverse your health issues, you want to prevent cancer, you want to go a different path, you're going to need to shift your mindset and you're going to change some things, really, right? Remember that if we continue doing the same thing, we're probably going to get the same outcome. So if we want a different outcome, we're going to have to do different things. And it doesn't have to mean that you're going to make abrupt major changes in your life, but I invite you to consider that maybe there's even just a few little things you could start to change without creating too much stress or drama or chaos. You can start to create some small changes that'll start to shift things in the perspective of enough that you're changing the way your body's functioning and you're changing your ability to reverse your health issue. I've been able to completely eliminate migraines that I had for decades. I've been able to completely put to a standstill a rare arthritis that many people struggle with and don't know that there's anything they can do about. And I've helped thousands of women to clear HPV negative and it never comes back again and they never get cancer. So I'm just here to share that with you to say, I hope this gives you some hope and some new perspective of how to look at things. And so let me share with you these 8 susceptibilities that I find with human papillomavirus. And actually, I think you're going to find this crosses over with many other health issues as well. So the first is stress of all types. So stress, we all are exposed to stress as humans. We have stress, financial stress, relationship stress, work stress, you name it, stress. And likely we have trauma, either accumulative small traumas or big traumas. We end up experiencing trauma as humans. Now we know that we have these experiences with stress and trauma, and they stick in our system. Our stress hormones are affected by the stress and trauma, and then it gets stuck. It's like it changes your set point. And it's different for each of us. And I wrote about that in this book, the Master Your Stress, Reset Your Health book. So if you're wanting to know more about how stress and trauma affects your stress hormones and puts you into your unique version of stress mode, where your cortisol and adrenaline is stuck either too high or too low, not just by the stress of the day, but actually based on the stress of your life. And your body learns a pattern, and it can get stuck with cortisol too high or too low at different times a day, adrenaline too high or too low at certain times a day. And it's only once we finally do the right test to figure this out that then we can give you the right treatment to solve it. Because there are, and well established in research, including all the references in this book, showing you how so many different diet, lifestyle, what I call stress recovery activities, as well as nutrients and herbs, can help bring our cortisol and adrenaline back to optimal. And not as a magic pill, which means that it would be suppressing it or masking it or temporary. I mean as a real healing, where your cortisol actually comes back to optimal and your adrenaline actually comes back to optimal. We're essentially erasing the past effect of stress so that your system can reset to optimal. And that's what I see in my practice, and that's what I've done a lot of research on. And that's a huge underlying cause of why, if HPV is not going away and you've tried all the other things and you're like, why is it not going away? It's likely that you haven't addressed your stress hormones and got them back to optimal, including your neurotransmitters like serotonin, dopamine, and GABA. And that's something I specialize in, is helping to re-optimize neurotransmitter and cortisol levels using nutrients and herbs and diet and lifestyle. So this is solvable. You're not stuck that way. The second major susceptibility with high-risk HPV and other health issues is dietary in that we often are choosing foods that are less than optimal in terms of nutrient density. Also, could be foods that decrease our immune function, like anything that contains sugar, cane sugar, white sugar, reduces our immune function right away. So does alcohol. And inflammatory foods. Most common is gluten and dairy, but we can test for food sensitivities to identify the foods that are inflammatory for your body. And potentially, you might be following a diet that is leading to nutrient deficiencies, or you might have digestive issues that are leading to nutrient deficiencies, and you may have leaky gut, which is when the intestinal cells are damaged by stress and toxins and are no longer absorbing nutrients well and ending up setting you up for inflammation. And that inflammation in the gut and the nutrient deficiencies from the gut translate to inflammation anywhere in your body, including in the vagina, leading you to be susceptible to HPV. So this is a susceptibility number 2. Susceptibility number 3 is microbiome related. Both our gut microbiome and our vaginal microbiome. Really well established in research now that our gut and vagina microbiome are communicating with each other, influenced by each other, and when one is off track, it throws off the other, and they're both disrupted by stress, pesticides, antibiotics, many other medications. And so it's very common to have your microbiome disrupted, both in your gut and vagina. And when that happens, then we become more susceptible to all different kinds of infections, including high-risk HPV virus. And this also happens for women during peri and postmenopause when estrogen levels drop. Vaginally, our microbiome changes, making us susceptible to HPV. So this is a huge susceptibility, right? If you're just taking a mushroom extract and never addressing the low estrogen vaginally, then likely the HPV is not going to fully go away because you're still haven't addressed that hole in the bucket, you see? Or if there's an imbalance in the microbiome and we never address it, even though the research is clear, we never address it and it's not available. The testing's not available in the standard medical clinics. And this testing does exist, but you're going to need to get it from a practitioner like me and a clinic and a lab that offers it so we can actually identify the imbalance and then we can address it. There are ways to actually re-optimize your microbiome. Absolutely. I see it all the time. So the next susceptibility is hormone imbalance. We talked about it a little bit here, but this would be estrogen too high or too low. So for some women, estrogen is too high. For some women, estrogen's low. And both of those can make us susceptible to high-risk HPV and other symptoms. Also, if progesterone is out of balance, and also other menstrual-related hormones or other hormones. Sometimes women are more likely to develop HPV during pregnancy, postpartum. It also has to do with estrogen detoxification. Estrogen has to be detoxified in the liver, and if that's not going well or there's more toxic estrogen, that can also increase risk. So we need to measure, and it's not just a blood test. We need to do a specialty urine test to understand what's happening with your estrogen, progesterone, testosterone, and other hormones, and detoxification, and get them working well so that your body can protect you from many different health issues and cancers, including HPV-related cancer. The next susceptibility is blood sugar imbalance. So what happens here is, and the research is very clear that yes, with diabetes, there's increased risk of high-risk HPV and cervical cancer. But even if it's not diabetes, even if you're having fluctuations in your blood sugar, a little too high, a little too low, we know that predisposes us to so many different health issues and cancers, including cancer associated with high-risk HPV. So we need to be looking at blood sugar levels and helping you to re-optimize them by looking at your diet again. How can we make sure you're getting enough protein at regular intervals and exercising to increase your insulin function? There's so much we can do to help get your blood sugar rebalanced again. And then we need to look, the next susceptibility has to do with methylation and MTHFR gene variations. MTHFR is a gene variation that has to do with converting folic acid to folate, which is the active form of the nutrient B9, vitamin B9. And what can happen is some of it is because we have a gene variation, which I have MTHFR gene variations, and also The things that affect our use of our B vitamins, like stress, toxin exposure, and more, inflammation. All of these things make it harder for us to use our B vitamins effectively. And if we don't have enough B vitamins and folate, it's hard for us to keep making healthy cells. And so we become more susceptible to the effects of high-risk HPV. So we need to address this. We need to do the right tests, which most practitioners are not doing the right tests, and we need to get the right doses for your body. And then we can really optimize your methylation. The next susceptibility is related to abuse. Any history of emotional, physical, sexual abuse, including narcissistic abuse, is associated with higher risk of HPV, high risk HPV, and cervical cancer. So we need to be helping to identify history of abuse or current abuse and helping women to recover from abuse, because we know that I spoke about stress and trauma, and now I'm specifically talking about abuse as a trauma that makes women susceptible to high risk HPV and cervical cancer, let alone many other health issues. So the thing is, we often are hearing about the issue with abuse, but we don't hear about how it's possible to recover. So I want to emphasize that if you've experienced abuse in your life, that it's absolutely possible to take steps to help you recover from that, to help you get out of an abusive situation and recover from it. And then the eighth susceptibility has to do with toxin exposure. What happens is, of course, we're exposed to so many toxins in our food, air, water, and more in our environment. And sometimes then we're exposed to mold toxins in our buildings. And other times we're exposed to even, I would consider, infections and medications as toxins that end up affecting our ability to protect ourselves from high-risk HPV. So we need to help your body recover, to detoxify safely and effectively without making you feel worse, to recover from infections and medications, and even if you're still taking medications, help you to recover from them and hopefully decrease the need for medications as much as possible. So these are the 8 susceptibilities that I find, the holes in the bucket that are making us susceptible to high-risk HPV. And as we systematically address these, right, we're not just going to, yes, there's no magic pill, but that doesn't mean we're going to go just taking a random bunch of pills. So many people, that's what they're doing, is they're searching and they're like, oh, this sounds good and this sounds good, or someone said I should take this and someone said I should do this. And now you have like 10 pills, but you don't have a plan, right? You're just essentially guessing and throwing spaghetti at the wall and hoping it does something, hoping it sticks. It's that classic throwing spaghetti at the wall. And so what I would say is I recommend, and I find it's much more effective to be strategic and really think it through. And so you can be throwing a dart and a dartboard and hitting the bullseye instead of throwing spaghetti at the wall. And the way we do that is actually with testing, because instead of guessing, right? Instead of guessing, oh, maybe I have a gluten sensitivity. Maybe I have a microbiome issue. Maybe I have an estrogen issue. We're guessing, and we might not get the results we want if we're just guessing. Much better to do specific testing. The testing exists. We can do, and we can give access to get this testing so that you can know for sure what is your cortisol. We can know for sure your microbiome, your hormones, and you can get help with exactly the clinical, safe and effective clinical doses. So you don't have to be guessing. You can have expert guidance to help you through this. I offer online group programs specifically for high-risk HPV, and I work with patients one-on-one to help them to finally be able to figure out exactly what's happening in your body. You're not guessing anymore. You know exactly, and we can make a very strategic plan and guide you every step of the way. And in this way, we're way more likely to get where we're trying to go. I see case after case. Even simply this week, I've seen at least 5 or 6 women come back with negative HPV, negative abnormal cells after following this process. And so I encourage you, if you've been in the struggle, you've been in the fear, you've been even paralyzed by the fear, and in this thinking that either it's not possible or looking for the magic pill, I encourage you to stand back and go, wait a minute, is that really what's going to help me be most successful? Connect with your real intention, which is to get HPV to negative and prevent cancer. And go to my website where you're going to see all kinds of different testimonials. Just go to clearhpvnow.com and you're going to go to the testimonials and you're going to see video after video and read story after story of women who have done this. And you're going to start to go, wow, this is possible. I don't have to believe that because I can start to believe this. And then you can connect with my team so that we can help you to know what's the best option for you, a group program, one-on-one, or both. So we can start guiding you down this path. You don't have to figure it out on your own. You don't have to be on your own anymore. We're here to help. There's ways to get access to this, and there's ways to guide you step by step so that you are actually ending up. When I talk to women, I just talked to a woman today who got her negative results back, a 70-year-old woman who had been testing positive for HPV for over 7 years. Her doctor was giving her no hope or answers of what to do. She worked with me over the past year, really over the past 17 months, or a little over a year. We worked on addressing each of these 8 susceptibilities for her. And she got her negative results. And you know what she said? She said, I never stopped believing it was possible. There was days that I was disappointed or frustrated, but I never gave up on my intention of getting HPV to go away. And then she said when she saw the results, she was so surprised. It was like something you know is going to happen. And then when it happens, you're so pleasantly surprised. You're like, how did that happen? And yet we know exactly how it happened because she followed exactly the proven protocol that I'm describing to you. And so now she's looking at those results each and every day and believing that she has now reached the reality where she has gotten that virus to negative and she knows exactly how to keep it negative. And I want that for each and every one of you. And I want you to know that that's possible for most every health issue that I can think of. So if you're struggling with HPV or any other health issue, I welcome you to reach out. Just reach out to me. You can message me below. You can reach out to through my website at drdoni.com, doctordoni.com. You can schedule to be a new patient. We can talk through your case and I can help you to know your next steps. And you can also set up a time to talk to my team so they can help you know what's possible. Please know that if you're in a place where you're struggling and you're frustrated and you're hoping there's another way, there likely is another way. And I'm happy to share that with you and help you to find that path and walk with you as your guide down that path to transforming your health and improving your future, your quality of life, your longevity, because I believe it's absolutely possible. Thanks so much for joining me here at How Humans Heal. If you are new, I welcome you to subscribe and join me for the next episode. I look forward to connecting with all of you very soon. Take care.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.